Welcome to all our listeners to the Health for All podcast. I'm excited to have Joe Leggio on my show today. Joe is the Executive Director of International Services at Northwell Hospital, one of New York City's largest healthcare provider. Over 23 hospitals, 700 plus outpatient facilities, and over 80,000 employees. Joe has had a rich career. The best way to put it is a combination of retail, fashion, marketing, and bringing all of that together and the richness that he brings with to define patient experience and customer experience in healthcare. Joe, a big warm welcome to you on the Health for All podcast. I'm super excited. We're talking from across the world. Me sitting in Indonesia, you're in New York City. Thank you so much for making it to the show.
Amazing. No, thank you to have me. It's a pleasure to be here. Excited.
Superb, Joe. And Joe, you're looking really, really sharp today. And we'll talk a little bit more about your ensemble a little later. But how are you doing today?
Great. It's a great Monday morning. It's fall. It's fantastic.
Superb. So, Joe, we're going to go a quick uh, fire questions between you and I, just
Sure.
to warm the listeners up before we go deep into patient experience. So, Joe, I know you're a fitness enthusiast, and I know you're also a musician. Um, Long runs or weights?
Great question. So it was long runs, but it is
Yeah.
now weights. It is now weights. So 5 days a week it is weights, and 2 days a week are semi long runs, I'll say.
Clearly, Instagram and YouTube is doing its job really well.
Oh
Okay,
yeah.
wonderful.
The algorithm has changed, so the behavior has changed.
Okay, wonderful. Chocolate or bagel and cream cheese?
Chocolate. Sweet tooth all the way.
Okay, superb.
Sweet tooth.
Would you run the New York City subway for a day or be a part of a sumo wrestling league for a month?
No, I would run the New York City subway for a day.
Ah, really?
Absolutely. I think it needs some serious outside perspective, I think, to help it. So I'd be honored to do so.
So you're saying that people wouldn't be surprised if you crash it down anyway.
I don't know how much worse I could make it, but
That's right. That's
um,
right.
that would be an interesting job for a day.
Superb. If you were Chris Martin from Coldplay for a day, what would you do differently?
That's a great question. I think he does a great job. I would say there's always more to do. And to me, celebrities like Chris, one of their most valuable assets is their time, and they can donate their time to auctions and to be a part of fundraising by just going to
Mm,
lunch with someone, giving away more
mm,
signed autographs, um,
mm.
doing inspiring other celebrities to give as much as they give. So I think I would just try to use myself and my platform to just do things that don't actually cost me as Chris Martin any more money, but allow me to fundraise more just by using my name. And I'm sure I'm a PR person's nightmare because you dilute the brand if you're too accessible. But to me, you can continue to do the right thing in ways that really don't cost you anything. So
Wonderful.
yeah.
You are allowed to take a ride from point A to point B for not more than 30 minutes, 25 to 30 minutes. I'll give you a little bit of flexibility with one personality or one very famous prop, which the world would love to have, or an experience in that journey. What would that be if you were to pick any one of the three?
It's so interesting. So I guess it would be with the person. It'd be to get
Okay.
to someone. I think that perspective is really powerful when you can get to hear someone else's perspective. I think it's great. I would say if the person isn't living, I would say my grandfather.
Okay. Okay.
He passed away a few years ago, and I knew him my whole life, but I always kind of say what I wouldn't give to have another half hour with him to talk about so many things and get his advice on things and tell him what's happened the last 7 years. Um, I would choose that.
I love it. Love it.
Yeah.
Uh, Joe, my last question to you. Okay. Since the world is talking about Swifties and Taylor Swift and everything about them, uh, What do you think her next song's lyrics should look like if you were to get three lines on that song?
Another great question. So one, I will proudly say that I'm a Swiftie. So big Taylor Swift.
Ah,
I
okay.
went to see the Eras tour, so big Taylor Swift fan. Um, I don't know if I'll get the exact lyrics right, but I think it'll be she's clearly in love and she's clearly happy. So I hope that there's kind of a bit of a pop rom-com, vibe to it of, you know, falling in love, falling free, falling into you and me, so
Ah,
something that it's like anything else when you're in love and you're happy, you let yourself go. It's scary, but it's also amazing. So I think it'd be something to that effect. And if she does use that, I'll expect royalties for the for my line.
okay, wonderful. While you're in that Swifty mood, why don't you sing us a little one-liner from a Swifty song?
Oh, we don't have time for that. I'd have to prep the whole thing. But it just her songs, like no matter what they are, it's like even Welcome to New York, right? It's been waiting for you. Like she's fun. She's a great role model. Uh, if you read all the articles about what she's done to her
Yeah,
team and how she's, taken care of them and how she's helped everyone, what she's done for the economy, it's so great in 2024 to have an incredible role model that's just doing good,
superb.
inclusive, supportive. So big Swifty. So my line is welcome to New York. It's been waiting for you.
Love it, Joe. I feel like I know you really well now. Superb. Okay, so uh, Joe, moving to early days, right,
Yep.
of your career, you've had a not so typical career into healthcare. We'll get to into healthcare a little later, but tell me a little bit more about your time uh, with big brands, with shoes, with merchandising, with marketing. And of course, Louis Vuitton was one of the largest brands that you were associated with, and that oozes customer service and customer centricity. Would love to hear about your early stories.
Yeah, absolutely. So it started really just in retail. As soon as I was able to work, I got a job. I wanted to start saving money, making money. And I worked actually for CVS, like a drugstore pharmacy, in the photo department when people still got their photos processed,
Ah,
5 millimeter. So I know how to do that. And
are you still on the ads?
no, I should be. I should be. I feel like you're right. It's another missed opportunity. Uh, but I did that. And it's kind of interesting. I was shopping at a retail store in a
Mm,
mall, a brand American Eagle,
mm,
a casual brand. And the store, and I was just there talking to people and talking to the salespeople and just shopping. And the
mm.
store manager came over to me and she said, "Hey, what's going on?" And we got to talking. And then she's like, "This may sound crazy, but do you want to come work here?" And I was like, "No, what do you mean work here?" I said, "I have a job." And she's like, "No, no." She's like, "You're going to be great." And so we spoke and she hired me off of the sales floor. And that was my interview. She just spoke to me and we were talking and I was shopping and so that's how it started. And so I worked for American Eagle for years. Loved it. I put myself through I worked through high school, I put myself through college working, and it was exciting. It was a fun brand. It
Mm.
was great. And then it evolved and I, became a supervisor and then a manager and then a store manager. And I was the youngest store manager in the company's history. I
And
was
all of
20.
this in New York City?
Yeah. Well, this was in Long Island, but in New
Got
York.
it. Mm, mm,
Yeah. And so I was, a manager. I was so young, but it was exciting. And again, it was so exciting because everyone, there was so much support and people really believed in me and I believed in what we were doing and what I was doing. And we were selling denim jeans,
mm,
but it was a lot of fun. And then it went from there. And then I went to J. Crew for a little bit, and I worked in J. Crew men's haberdashery for a little
wow.
bit. So very
Yeah.
different pace,
Yeah. Yeah.
a whole different vibe, but fun and different. And then I was in Nordstrom, and I was shopping there as well, and I was with someone, and we were in women's shoes, and they were like, "Hey, you should come and think about working here." And I was like, "Really?" And so I said, "Okay." So I applied, and when they placed me, they said, "We're going to put you in designer women's shoes," and I said, what? I was like, I don't know a thing about designer women. And they said, don't worry, we'll teach you. And so I spent several years there. And then that's really where I started getting into merchandising.
Mm.
Um, Loving the visualization of the product, of the story it told, of how we merchandise, why. And it's an art. It's an art form. So I found it fascinating. So I was there, ended up becoming one of the leaders there. And so I knew more about, women's shoes than I ever thought I would in my life. It's a lot of fun. And
Joe,
then
I'm gonna call you when I pick up my next shoe for my wife.
there you go. And I won't steer you wrong, I promise. I'll know what size, I'll know about one's small, one's large, what's comfortable, what's daytime, what's evening. It's a whole world. And
Super.
then, yeah, and then from there, it kind of happened again. Louis Vuitton saw me and wanted to open up shoes, which was a relatively new category for LV at the time. This
Mm,
is, oh my God, 14, 15 years ago, give or take.
mm,
And they recruited me to open up and run their shoe division at one of their stores. And so I did that. That spiraled into into leadership, management, merchandising. So again, then I really got into visual merchandising. And so then I went to Louis Vuitton in the city. I was in multiple locations. I was in Saks Fifth Avenue. I did the windows on Saks, Louis Vuitton windows. I did Fashion Week. I did a bunch of magazine photo shoots. So the rest became history, and I loved it. It was exciting, very glamorous of just being able to do that, and it was a lot of fun. It was a lot of fun.
what was your biggest celebrity encounter at the windows?
So not at the so of this someone that I actually got to speak to, um, Leanne Rhymes.
Mm,
Yep,
nice.
Leanne Rhymes. Yeah. There was a lot of celebrities that you just saw. So Angelina
Yeah,
Jolie, when she was
yeah.
there, she was the face of LV. A couple of famous people that you just like, oh, and then you're like, oh yeah. It's kind of, it's one of those things. It's like the double take, and you're like, wait, are you? Oh, okay, yeah, who are you? So,
You are
uh,
you. That's right.
yeah, you are you. Yeah, it's a weird moment
Super.
when you have celebrities like that.
So, Joe, when you were talking through your career journey, I kind of observed the fact that you've moved from uh, local mass chain brands to fast fashion. American Eagle would be, much more
Yeah.
economical fast fashion, and then you move to J. Crew, which is more slightly premium, uh,
Yep.
premium men, mostly, uh, uh, you know, uh, northeast focused,
Yep.
for the most part. Because I know, because I lived in Boston for quite some time. I used to wear quite a bit of J. Crew. And then you went to Nordstrom, which is more chain, and then you handled a category
Yep.
within the premium brand. And then you went to building that premium category for an extremely large brand. I love the way that your journey has taken you from understanding of the industry to specializing to a particular category and getting to the closer and closer to the customer,
Yep.
to what the customer needs are. It's fascinating, right? Um, Across this entire journey, I know you've picked up a lot of nuances and learnings, etc. Um, Tell me a little bit about, so post Louis Vuitton, why
Yep.
did you decide to? I mean, you're working with one of the best brands, and I can sense from your personality that you are everything that Louis Vuitton would want or a
Yep.
Prada would want. Why did you decide to move to a different industry?
So it didn't happen. I didn't plan it, I should say. I did not plan it. My journey took me there. So it was 2008, and the economy, took the turn that it did in 2008. So I was supposed to continue to evolve within the visual merchandising
Mm,
space. And that in 2008 wasn't a great time to do that. So I said, you know what, that timing is everything. So I went back to grad school. I got my MBA in marketing and advertising. And I was going to school full time. I was working at the university I went to school for full time. And then I was doing Louis Vuitton part time. But I
mm,
needed the next thing.
mm,
And I wasn't sure what that was. And there was a temporary assignment to cover someone's maternity leave for 8 weeks, doing marketing in
Mm,
healthcare. And I said, you know what? I'll try it. It's close to home. It's short
mm,
term. It's giving me good experience. I'm just getting my master's in marketing. This is a marketing position. Let me just do it. And it was down to kind of timing what was happening. And I think I felt comfortable because it was a temporary assignment. So I kind of got to try it and do it without having to fully commit to it. So it didn't feel at the time that I was making this massive career change. It felt like I'm going to spend the next 8 weeks doing something a little different. And I was okay with that because it was 8 weeks. Here I am, 13 years later. And again, I wouldn't change it for the world. So that's how it happened.
mm.
Now, there's a crazy story as to why I kind of really got hooked in, and then there's even crazier story as to why I stay. Um,
Okay.
so so that's how I got there. I'm doing my 8 week assignment, and I'm interviewing for other jobs back in
Yeah.
fashion, and you know that
Mm,
the 8 weeks ends up becoming, I think, like 12 weeks or so. They extended it a little bit, and it was great. Met lovely people. It was fantastic. I'm helping I worked on the cardiovascular service line. So I'm working for the vice president of cardiovascular services, and she would do her holiday party in July because she wanted to have an outside barbecue. And she asked me to help her write a speech, and she wanted me to cut famous audio tracks from famous songs and put them inside her speech and do this whole mashup. And so I was like DJing doing this mashup for her. So of course, I knew how to do that because of my background in theater, my background
yeah.
in action. Why wouldn't I know how to do that?
Yeah.
So I do that, and she says you have to go meet this woman, Susan. Susan was the CEO of Northwell's largest hospital, largest tertiary hospital. I meet Susan, we talk. She goes, "Come see me tomorrow." I go see her tomorrow. I meet with the executive team at North Shore, and she offers me a job. They a brand new job they made. She goes, "I don't know exactly what we're going to do with you yet. Marketing,
Yeah.
hospitality, this whole world of patient experience was a buzzword that I kept hearing, and it was incredible." So I turned the job down. I said no.
What?
I said no. I wrote my
Okay.
thank you card. I did all the things you're supposed to do, right, that are polite and professional.
Yeah.
2 weeks go by. I'm in a different town. I'm at a gym, and I put a set of weights down on the mirror, and I look up. I look up in the mirror, and behind me is the CEO of the hospital. And I'm so nervous. I'm all red. And I'm like, oh my gosh. So I turn around, I look at her, and she looks me in the eye and she goes, "I offer you a job and you didn't take it. That's very interesting." And I'm like,
Mm,
oh my God, I'm so nervous. And she's like, "Joe," she's like, it doesn't matter to me what other job you have or where you think you're going to go work. It'll be the biggest mistake of your life if you don't come here and work for me. So I'll see you tomorrow and we'll figure it out." And she walks away. So now I'm like, holy cow, what do I do? And I was so shocked because this woman didn't even know me. She met me one day. She saw me at this party. I met with her for 30 minutes the next day, and she's believing in me so much. And obviously, she spoke to people who I'd been working with, and I'm sure they had lovely things to say about me. I hope. And
mm.
so I was so. This was one of those decisions where I was so concerned, like most of us are, about making the right decision,
Yeah.
right? Because we believe there's a right and there's a wrong. And
Yeah.
that's a really tough thing because there's not a right and wrong. There's just left and right. There's just this or going that way. And both have good,
Mm,
attributes and qualities, and both potentially have negative.
mm.
But you have to make the choice. So of course I couldn't make the choice. So I decided to make it impossible to hire me. So I went in the next day and I asked for everything. I was like, there's going to be no way she can say yes to this. And that way I wouldn't make the wrong decision because I had already gotten and accepted another job in fashion, a dream job. I was going to run special events for Diesel Jeans for North America.
Oh,
And so,
wow.
huge job, kind of combining events, marketing, a mix of high-low fashion, right?
Mm.
Diesel was a premium denim company. So, perfect. So, I went in there, I
And they were
asked,
also starting their shoe category, I was guessing at that same time.
yeah, they had it already, but
Yeah.
yeah, it was, but
Yeah.
this was really much on customer-facing
Got it.
uh, events, right? So, how do we build the brand? How do we continue to do customer engagement events? So, I went in there, I asked for everything, and I asked for things I thought she wouldn't give me, and not just personal things, but I needed a budget. I wanted her support, right? I didn't want to go into every meeting and every conference room and be told no, right? Joe, this isn't fashion. Joe, this is
Mm,
not for
mm,
profit. This is healthcare. Why hire me, right? If all you're going to
mm,
tell me is no, why bring
mm.
me into this world? She said yes to everything I asked for.
Oh, wow.
So it was my first lesson that I should have asked for probably a little bit more because I probably could have gotten it. But that's
No,
how it started.
I think it speaks volumes about two things. One is how much of a conviction a decade and a half back someone like her had in customer experience, customer centricity, and changing the world of healthcare. And seeing that a person like you, with the dynamism that you bring in, because it doesn't happen normally to every hospital CEO wouldn't look at somebody who's a leader in fashion and say, hey, come do something in healthcare. So that's amazing. I think it's a two-way. I think she had an eye and she had a
Yep.
vision, and then you fell in place. What a story, Joe. Amazing. Uh,
Yeah.
I love it. And so now you've spent over a decade and a half, right, in healthcare, and a lot of it is focused on improving patient experience. Tell us a little bit more, and I think the listeners would love to hear this because a lot of them listening probably are also hospital networks that are trying to establish international communities, trying to bring in medical tourism, trying to even improve the patient experience in their existing various different tiers of hospitals. Tell me a little bit more about your role to activate what you're doing right now in patient experience.
So it's a great question. So there's kind of, I'll say two parts to it. So
Mm,
prior to my current role of being executive director for international, which again is very patient centric, and I'll talk about that.
mm,
My role prior to that was I was the vice president for what we call experience services and experience
mm,
operations for three of our New York City hospitals. So I had all of what we call experience departments, so the Office of Patient Experience, um, our chaplaincy team, our volunteer team, our housekeeping team, our food and nutrition team, our laundry and linen team, our administrative staff, and kind of the secretaries on the unit team. So almost 550 people. And my role and my passion is really to get to the core of what our business is, which is taking care of people, right? And of course, their families. And
mm,
how do we change the way someone feels when they're there? How can we make them more comfortable? How can we make things more accessible? How can I make every decision with the first priority to be the patient? And in hospitals, what I found right after I kind of one decoded all the acronyms, because that's all everyone talks in is acronyms, and you have to understand them. After I understood the operation of what we're trying to achieve, what mattered, um, once I understood that, I started to realize we make a lot of decisions, and I'll say we as the global healthcare space, we make a
mm.
lot of decisions operationally first. What is achieving an operational metric, a financial metric? And sometimes we do that at the expense of the patient.
Of a patient, yeah.
And
Mm,
so I kind of I saw that because I didn't have a healthcare background and I could see, I get that you're, getting the number on the balance sheet you want, or you're getting an Excel spreadsheet or a graph to look the way you want, but you took that person for a CAT scan at 3 in the morning. Like I know if I'm sick home, I don't want to be up at 3 in the morning. I want to be sleeping. And so why did you do that? And we go into these reasons as to why that happens. And you look at something like hospital food, and you said, well, patients are filling out surveys, and then thousands of them are telling you they don't like the food.
mm.
Have you tried to fix the food? And you start to realize, well, no. And there was this whole different way of thinking about what's most important to the patient, and we shouldn't pretend that we know what it is. We shouldn't assume what it is. We should ask them. We should listen. We can ask questions to understand. But then what you do is you have to take that information and make a change. And so, really about kind of living and breathing a patient and customer and people focused world where every decision we make is about the people. And so, how are we thinking about that differently? How do we incorporate patients into every decision we make, into every committee we go on? And I feel like a lot of us say these words, right? These are kind of the industry buzzwords. These are a part of our mission statements. These are our vision statements. Saying it is one thing and living it every day is different.
Was there
Um,
a particular, did you do this more in outpatient? Did you do it more in inpatient? Where did you see it first as the as the most important area to, I know it's a journey,
It
right?
is. Yep.
All the way
Yep.
from home to when you
Yep.
recover and post recovery monitoring, all of that. It's the entire cycle. But
Yep.
when you started your effort, Joe, where did you think, okay, you know what? I think I need to concentrate on this timestamp so that,
Yeah. No, it's a great point because there's so much. There's
yeah,
just so
yeah,
many touch points. Yeah.
yeah.
So in my first couple of weeks there, I did something that people didn't understand why. And I asked to ride our ambulance for a week as the marketing patient experience guy, right? And again, I'm not clinical. And I mean, I'm not clinical, meaning if I see blood, I will pass out. And if I see someone throw up, I will do it too. So, like, I am not built for the healthcare clinician, but I wanted to ride the ambulance. I wanted to see what the start of someone's experience was and what did it feel like? What did it look like? What did it sound like? And then I started in the emergency room, right? Which, depending on your hospital, right? 30%, 40%, 50, 60% of your patients, that's your front door. What's the experience? So I started in the emergency room, on the ambulance and in the emergency room, and I wanted to understand that. And so I had to spend a lot of time focused on that experience. And what mattered to that patient is very different from what matters to the inpatient
Mm,
patient,
mm,
right?
mm,
So, and then I focused a lot on inpatient, and that's where I spent the biggest time because patients are there longer. There's so many more touch points. We would do patient tracers, and then we find in a 48-hour stay, every a length of stay of 2 days, 2.5 days, a patient interacts with 72 team members on average in 48 hours. 72 people between environmental services, food and nutrition, nursing assistants, physicians, ACPs, residents, fellows, radiology technologists, phlebotomists, like just someone from engineering came in the room to fix something. You name it, and you see the count go up. And who's hosting a 72-person party when you're sick? Who wants to engage with that many people when you're sick? So we spent a lot in inpatient. And then, of course, we got to outpatient and ambulatory as, the care model moved there. So you have to start somewhere. And so I wanted to start essentially in the front door.
So before I actually move into what metrics you saw changed, um, can you tell me a little bit more about, so you said you drove the ambulance. How long did you drive the ambulance to actually
Well, I did a ride along, so I didn't physically drive it.
Okay, okay.
That probably wouldn't have been safe for anyone. But no, I was in it. I was in it. I
Did
did
the
it for a
did the
week.
patient make it, Joe?
They did. All of my patients made
All
it,
of
and they
them.
had a great experience. They had a great experience. They weren't sure why I wasn't more helpful clinically.
Yeah.
Normally there's two people that arrive to a scene, and they had three that week. So they felt extra special. I think probably more people thought I was a supervisor because I just watched. I didn't really do too much. But
I, with the life that you bring in, I'm sure they felt a lot more alive in that ambulance. They're like, yes, I think we can make this. I think this is a new
exactly.
ray of hope. Uh, with New York City's ERs, right? It's it's one of the most busiest in the world, right?
Yeah.
You're talking about 2 to 4 hour wait times to even get to attend it and get some help and actually get the help that you need. Uh, what is it like in Northwell?
So it's a great question. So every day is different, and every
Mm,
minute and every hour is different, because of just everything. To your point, right? It's New York City. There's so many things going on. So at Northwell, we really try to have number one, be as transparent as possible, offer as many potential options of care as possible, so that we can essentially decant and not have our waiting rooms and our emergency rooms packed. So the first thing we do is on Northwell's website, you can see the wait time of every emergency room. And you can decide before I go to Lenox Hill's waiting room, before I go to North Shore University Hospital's waiting room, I can check the website and see how long is the door to doc time. The time that you walk in that door to the time you're going to see a doctor or a
mm,
provider.
mm,
So we want to be transparent about that wait time is, so you know what it is.
mm,
Two, we have redesigned workflows and staffing models to accommodate for different types of emergency patients, right? So kind of things like fast tracks and where patients we know are not going to get admitted but need to be seen because they have a little bit more of an acute issue, and we see them, but we set up a whole different team for them. and a whole different space. We've opened up and have partnered with urgent cares. So we have 57, I believe, 57, 58 urgent cares, or Go Health, we call them. And the thought is, do you need to go to the emergency room or can you go to an urgent care, right? That
Mm,
will have imaging and have the ability to do swabs and testing. So maybe some respiratory issues, any sort of surface area, right? Now we always say if you think you need to go to the emergency room, you should go to the emergency room. Don't ever
mm,
second guess yourself.
mm,
So we try to do a lot of things so that patients don't have to wait. And I'm really proud, and in Lenox Hill, and again, this changes every day, and
mm,
it depends on the time of day you come.
mm.
But we really try to have a door to dock time in under 40 minutes.
Oh,
So
wow.
yeah, so you're not waiting like that. And again, and a lot of times it's much shorter than that. Um, right now, I think I just saw it. I think we're at a 15-minute window. So within 15 minutes, you're going to get seen by a provider right now.
That's
So
brilliant.
yeah, so our patients expect it as they should. It shouldn't take 2 to 4 hours to see someone.
That's brilliant. And have you also incorporated um, virtual consultation, and I'm sure you have, right? And home service and home care, etc., for the less critical bucket. And are you using AI and technology disruptions and any form of innovations as well?
Absolutely. Yeah. So and we were piloting this right before COVID. Obviously, COVID really accelerated it, but
Mm,
we had the ability to do virtual telemedicine, and emergency telemedicine. So patients
mm,
can log onto our website and do a virtual visit with an emergency room physician, and have that at home. And there you're talking wait times are in the seconds to minutes.
seconds.
It probably takes you longer just to fill out your name and your form and all your information. And then you get seen by a provider. And so those providers they're Northwell physicians, they're emergency medicine trained physicians. They are using, our software, our platform. There's an AI algorithm that's, of course, backing them in terms of diagnosis, treatment plan, pathway, to make it as efficient and as
Mhm.
accessible as possible. So yeah, we're absolutely doing, and then not just with emergency room, but across every specialty.
That's phenomenal, Joe. So now I'm going to try and weave threads between your life with uh, bags, stilettos, merchandising, and now with catheters and sutures, right? What is what is it that you bring from an industry like fashion to healthcare, and you've actually transported learnings and said, and it's actually working?
So it's something I try to do every single day. I think it's
Mm,
never done. It's never finished. It's in fashion and in specifically high fashion, right? Like Louis Vuitton. It is so customer focused and so brand focused, right? And you look at fashion, we're selling handbags and accessories and shoes. And in healthcare, to your point, we're doing surgeries and providing medicine. So we each have a product, right, that we're selling. And that's what's happening. What I try to do is take it the step further and say, all right, we need to be so patient and customer focused on what they want, what matters to them, and create an experience, right? And a
mm,
feeling. When you walk into a Louis Vuitton store, you feel a certain way, right? And you feel that way because of all the things, the way that employees are dressed, the design of the store, right? The lighting in it, the amenities they offer you in there, the standards of which the consistency of which they're meeting and talking to you. You they're creating their story and their brand, and it's so strong and it's so present. And the key is that it's so consistent. You feel it in every Louis Vuitton store you walk in around the entire world, right? They may look a little different, right? But they feel the same.
mm,
So how do I create that feeling of care, you know, empathy, being cared for and having all of your needs met, your expressed and your unexpressed needs. So it's about
mm,
creating that environment, building that brand, and the industry, right? Fashion, you're encouraged and you need to be creative and innovative, right? Because you have to
mm,
be constantly setting, the trend, living in the moment, being adaptive and constantly being flexible. I'm trying to bring that to healthcare. We're living our brand and we need to be creative and we need to be
mm,
flexible and we have to be innovative. And
mm,
some of that is technology and AI, and that's sure, but some of it is other things. Um, the patient gown, what we have people
mm,
wear, patient
mm,
food,
mm,
how we design facilities, what lights we use, the placement of those lights, right? And in merchandising, lighting is everything, right? And we use
mm,
lighting to feature products, to showcase color, texture, visually. That's part of the whole world. Lights are a big thing. And everyone around the world probably has the same answer if I ask them, what do you think about hospital lighting,
mm,
right? Or doctor's office lighting. And it's like, wait, why are we talking about lighting in a hospital? Well, there's lights everywhere in a hospital. And people would say it's harsh, it's super bright, it feels very institutional. No one looks good under that light,
mm, mm,
right? Yet why do we keep using it? Why isn't in 2024 with the innovations of the world, we haven't found better lighting that allows clinicians to still see what they need to do and obviously be safe and impactful, but not make people feel the way that lights feel. And it's a small, small little detail. And you know, that's just again a thing that I found is that most people, I think in general want the solution of patient experience. They want the solution of whatever problem they have to be the one big thing. If you just did this one big thing, it all would be better. And the reality is, there's very few things in life where it's just one big thing. It is the
correct,
culmination of 20 small things.
correct,
And when you look at each of those things, they seem like they're mindless, but they're actually very mindful. When you
correct.
put all 20 together, you've now created an experience. And again, fashion does that, right? It
Mm.
constantly is doing that. It's looking at that to the totality of the world. So I'm trying to get us to see it differently.
So looks like vanity has a way to get into your veins.
It can, and good vanity, right?
Yeah,
Just
good vanity. Good
good
vanity.
vanity.
Yeah. Yeah, good
Yeah,
vanity. I know I love this because uh I'm also working with a number of different leaders in the region to redefine um uh, how ergonomically and how sustainably and more human how can your surroundings in the hospital be more attuned to the patient? Color, music, smell, right?
yeah,
And I remember one thing now. That's why maternity homes are so much more different from a hospital, right?
yeah,
Because they are the ones who are who are catering to a woman's desires, a woman's needs in terms of how the look and feel is. They look more like spas and lounges versus just hospitals, right? The colors have changed. They become more subtle tones of brown and subtle tones of mauve, etc., versus the blue and the dark purple, which was all about being in a hospital. And I absolutely agree with you. Yeah. So is the world around you, right? Of course, I almost feel like when you walked in, people were like, "Wow, I mean, he's different. I mean, he thinks different. He wants to do different, right?" But everybody around you is still clad in those, light blue gowns and still running the way they are. How are you working around the people, the culture, the training to ensure that, like you said, those 87 or 100 different contact points that they have, everyone needs to exhibit what you just said,
yeah.
right? How are you working through that, Joe?
Yeah, no, it's a great point. So, because what can't happen is me be the only person who's living
Correct.
and breathing that, right? And
Yeah.
if
Yeah.
then I become, well, that's what he wants over there. That's what he does over there
Yeah.
versus what we do as an
Correct.
institution, as a team. So it is training, training, education, training, investment, development, conversation, and it is
Mm,
continuous. So we at Northwell, we built what's called our culture of care. And it's a
mm,
curriculum. It's a 2-hour curriculum. And CARE, of course, is an acronym. Why wouldn't it be? Connectedness, awareness, respect, and empathy.
mm,
And we took all 80,000 team members through
mm,
this 2-hour course
mm,
as the foundation. We wanted to say, what does patient experience mean at Northwell? What does it mean to connect to someone? How do we handle service recovery if things don't go right? We want to do it all together, all aligned. And here's our why behind this. Why are we doing this? Why are we working in healthcare? Why am I here? In some career journeys and pathways are easier to understand or make assumptions. nurses and doctors. They're there to take care of patients. They're clinical, they're hands-on. But why is someone from administration and a secretary there? Why is a transporter there? Why is someone from,
Mm, mm,
housekeeping, environmental services there and not cleaning an office building or an airport or a mall? Why are you cleaning a hospital? And you start to have to really draw the root as to everyone's why. And what you find, if you go kind of one layer below the surface, everyone is there because of a personal connection to healthcare, a loved one, a family member who's been through
mm,
something and they want to give back. People want to help people and they want to do it at a time that's most meaningful. And so they want to be a part of that team. And I think we should have to remind everyone of that. We have to remind each other of that. And then we have to kind of get on the same page with what we want to do so we're consistent. And then we have to live it every day. And that's the tough part, is consistently every day doing what we need to do. And so what I do is I create forums and I create moments and meetings and time for patient experience. I make time
mm,
for the culture. So we have, did away with some meetings and added meetings and just added meetings just to talk about experience,
mm,
just to talk about patient experience. We create forums where all of our recognition programs are tied to patient experience. So
mm,
everything we do in every which way, our quality meetings start with patient experience. Our revenue and finance meetings start with a patient letter, right?
oh, wow.
Because, and so that our executive board meetings, our board of trustee meetings either have patient videos, patient speakers, patient testimonial, because we can never lose sight of what we're doing and who we're doing it for and why. And at the end of the day, it comes down to that patient. So it's about building a culture that supports that, that creates that. And that's not easy to do. So that way, I'm not the only one, thinking the way I think. I now have an entire building that is so patient focused. And it's great. And it takes time. It doesn't happen overnight. You need good partnerships at leadership levels, at physician levels, at team member levels. And it is really just practicing what you preach. The worst thing you could do is say that this stuff matters to you and then not actually do it. Uh,
Absolutely.
not,
So, Joe,
not
how
live it.
much? So, I love how much you're doing with culture, and it feels like you're actually peeling off one by one, of multiple different stakeholders and letting growth happen organically as well, saying, no, you will learn how the new culture will percolate across the organization, right? How much of time do you spend in these forums versus actually talking to patients, listening to stories? I know you started there,
Yeah.
right next to that driver in an ambulance. But do you actually even now spend a percentage of your time with patients in the ER room just to even get a sense that we're still doing well?
Yeah, no, I do. I do. I think you can't ever not do that. The
Yeah.
minute you don't do that, then I think start to become very disconnected to what's happening because patient requests, needs change all the time, and they're different for
Mm,
every person. So you can't say, "Well, I've heard enough. I've kind of heard enough. I know enough." You never know enough.
mm,
Now, today, obviously, I'm very focused on our international patients
correct.
because there's another layer and level
Yes.
that's different from a New York City patient.
Yeah.
Um, Culture, food, cultural norms, how do we make them feel comfortable is very different. And so how do one, I understand what those are? How do I make them feel comfortable? How do I then educate my facility and my team so that they know
Mm.
what to do, what not to do, what's considered a sign of respect, disrespect. So it's about education and learning. So I constantly am talking to patients.
So now with international services, Joe, because that's a completely different ballgame, right?
Yeah.
You are bringing in new people into the already existing madness of New York City, right?
Yep.
Um, and of course, offering them world-class healthcare and making them feel a lot better before they go home. From a cultural sensitivity standpoint, etc., what regions, geographical regions, do you mostly focus on? Uh, because there's going to be a Pareto of patients coming in from, let's say, the Middle East or APAC or etc. Right?
Yeah.
So where do you spend your time?
So in a bunch of different regions, and it's really based on, again, patient request and demand.
Yeah.
And proximity. So we treat a lot of patients from Central and South America.
Mm. Mm.
And so that's a big kind of large region. And again, it's proximity, right? New
Correct.
York is relatively
Correct.
close. Um,
Correct.
so it's easier. We have many, many Spanish speaking team members in our buildings already. Of course, on the
Mm.
international team, everyone is bilingual and certified in a language. But so we understand we are built of the culture for many patients that we take care of. So an example is the Dominican Republic. We have an office in the Dominican Republic. And the
Mm.
third largest city outside of the Dominican Republic, there's Santo Domingo, the capital, Santiago, is Washington Heights. So
Mm.
it is in New York. They
Yeah.
call it little Dominican. So
Yeah.
same thing with Guyana. We have an office in Guyana, and
Yeah.
little Guyana is in Queens, and that's the
Yeah.
second largest city outside
Mm.
of Georgetown. So
Yeah.
we are that community, right, in New York. So we are making those connections. So Central and South America is a big component of us. We do care for many patients from the Middle East and the GCC region.
Mm.
Of course, we do a lot of work with consulates and embassies. There's
Mm.
a
Mm.
103 consulates in New York, so there's
Mm.
always international, um, you know,
Patients coming in.
diplomats, yeah,
Mm.
patients, anyone who's coming in, and being in New York, where it's a destination. So it's a little bit everywhere.
So, Joe, there's a lot of talk about patient navigators now, right? And they are plonked and plugged across the world to ensure that when a patient comes in from an international destination to your hospital, you're having the right experience all through, all the way from, hey, I think I need this implant to when you're back home and you're recovering well and you're consistently seen by a physician virtually. Tell me a little bit about how Northwell sees its patient navigators.
So it's a great point. So when we built our international program, and again, relative to some of the other US institutions, we're late in the game. There's been
Mm.
institutions that have been doing this for 30, 40, 50 years. And we haven't been officially doing it that long. So when we decided to kind of build our program, our process, our navigation, we looked at a lot of other centers and programs around the country. We looked internationally. We looked at
Mm.
ourselves. What are we currently doing in our own navigation programs for our patients domestically? And what we realized were two things very quickly. One, the amount of handoff that happens and needs to happen,
Mm.
passing from one department to another, to another, to another, was tremendous. And when you
Mm.
have a lot of handoff, you run the risk of the message getting lost, things falling through the cracks, information not necessarily maybe, being transmitted. So very well intended, but it's a lot of touch points. And so you're building something that's problematic. And the
Mm. Mm.
second thing is patients feel that they are being handed off.
Mm.
And by the time they've gotten to know someone or get comfortable, they're on
They've
to the
already been
next,
pushed
and
up.
they're on to the next, and they're on to the next. And so we're building a process that isn't, very sound, and the patients don't like it. And so when we built our navigators, and in many of our programs now, we call them they're 360 degrees trained, our navigators. So our navigator is going to, be the person who picks up that phone when you call, is going
Mm.
to be the person who's going to help get the records from your physician and connect your physician and find the right physician in our facility. And you're going to make sure we get things translated. We get you to see the right doctor. Then they're going to talk to your insurance company if you have insurance, and they're going to get authorization. They're going to help with
Mm.
if you need a visa or immigration status, they're going to process all of that. They're going to help book all of your travel plans if you need help with that. They're then going to make all of your appointments for you. They're then going to meet you at the front door and walk you to every single appointment. They're going to see you every day. They're going to visit you every day. They're going to be the one you call for anything. They're going to make sure you have your records when you leave. They're going to make sure if you had any financial questions, they're going to answer them for you. They're going to do everything. A one-stop, one person, no handoff. And
Mm.
so the only person you should ever speak to as a patient is your navigator.
Mm.
And what that has done, so one, that's hard to do. It's hard because you have to train someone in 10 different departments that they otherwise wouldn't know. Um, it takes time to build that skill set. But what the end result is a process that almost never has a breakdown.
Mm.
Patients feel so supported and cared for, and it's as efficient as possible because one person knows all the information about that single patient. So that's what we've done. It's
And
kind
I
of been
think what's fascinating is with this patient navigator, what you were talking about, Joe, of cultural change, patient centricity, messaging. And even the ability to almost handhold your patient, right, through the entire journey, it's almost like he's in safe hands. He or she is in safe hands, right? It's amazing. Any powerful stories that you can share in during what's worked extremely well of a complicated case and how a patient navigator and this entire end-to-end journey has helped in.
Yeah, actually. So one of my favorite ones is a couple of years ago, we have an office in Bermuda. And
Mhm.
we were in Bermuda doing a medical conference for the local physicians and nurses. And we were there. And one of a local Bermudian happened to be and see that there was a US health system in this hotel doing a conference. And her dad was sick, and he had went to the hospital and was told, and then gotten a teleconsult from another US hospital and was told he's going to have to have lose his leg. He had vascular diabetes, he had diabetes and some vascular issues. He was going to have to lose his leg. And the daughter was like, "This is just crazy. There's got to be another way. Why does my dad have to lose his leg? It doesn't have to happen." She sees that there's another that Northwell's there. She doesn't really know Northwell yet, but she runs into one of our navigators who is there and meets her. And she hears the story and what's happening. And the daughter says to our navigator, says, "Hey, could you help me? Could I get you my dad's records and can you have a doctor take a look?" And of course, we had our chairman of cardiology there. We had members of our vascular team there. And so the navigator went into full navigator mode and said, "Absolutely." While running this conference, she gets the patient records. She gets all the information. She gets the scans. She, in the middle of a break, does a mini consult so that we can speak to the patient, speak to the
Wow.
daughter, do everything. We look at the images. We look at we have a virtual visit, find out we can absolutely take this case. The navigator calls the insurance company. We then get the patient medically evacuated. Within 24 hours, we had a plane go down, pick that patient up, bring them up to Northwell, ambulances waiting at JFK for them to be brought into our hospital. Within 27 hours, that patient was inside the operating room, had life-saving surgery, and got to keep his leg. And he was able to walk
Wow.
out 3 days later.
Wow.
And have to lose his leg. And the navigator just did all of that in real time. And it's incredible. And we see him every time we go to Bermuda. We say hello and we see him. And he's a patient of ours now. And he's able to walk around at 80, 82, 83 years old. So, but
Wow.
it's being able to be there, know all the people, know all the players, know the process, and not have to hand off. Well, let me send you to billing with records. Let me send you to insurance authorization. Let me then call the doctor's office and wait for them to get back to us. She was able to do all of it. And that's the key, is those connections to streamline the operation. So it was a pretty great story.
What a powerful story, Joe. I love it. Uh, Joe, I'm sure there are, you know, hundreds such stories that you encounter on a day-to-day basis, and I'm actually envious about your job now. I love it, and you've given me a glimpse to an entire journey of yours. I almost felt like I was watching a Netflix show while you were talking through so many parts of your life and the way you brought this to uh, to almost a visual sense to the listeners, right? Uh, so what's the next big challenge for Joe?
Oh, well, that's a great question. Well, so one thing I will say is that we do have a Netflix series. We've had several docu-series at
Oh,
North.
really?
So we've done three,
Okay.
three different docu-series. I am actually in one of them for 20 seconds. So,
Okay, I'm gonna look it
uh,
up.
yeah, yeah. So that series is called Lenox Hill.
Okay.
It was filmed pre-COVID, but it came out during wave one of COVID, so May, April or so, 2020, and everyone thought it was about COVID, and had nothing to do with COVID. It was following four physicians, two neurosurgeons, an OBGYN, and an emergency room doctor, and following their lives of what it's really like to be a physician in medicine today in New York City. And what is it like with your patients? What is it like with them personally, with their families at home? And it follows their story. So it came out and everyone thought it was about COVID. And so there's nothing about COVID in there. They're like, how come no one's wearing any masks? And it's because it was filmed in 2018 and 2019. So then filmed a special series, a special episode that was about COVID. And it was, I think, one of, if not the first, publicly documented docu-series on COVID, because it came out, relatively recent, during then. And I'm in
Mm.
that episode, so it's the last episode. I'm in the first like minute for 20 seconds.
There you go,
It was
Joe.
great.
I think I
It
need
was
to
great.
edit now. I need to edit the introduction to say a Netflix cameo actor is also on
There
this
you
show.
go. That feels right. That feels right.
Awesome. So
Oh,
what's the
good.
next big
So
challenge?
what's next? So I would say for me, there's probably two things. One, it is continuously right now finding ways that I can incorporate AI and this technology
Mm,
actually being patient-centered solutions. Right now, and it's a fine line. There have been moments where we have put technology in somewhere and inside healthcare, patients don't want it. Despite how efficient it could be and how much it could optimize and how well it works, they want the human connection.
mm,
But we've got labor challenges, we've got workforce shortages, we've got fatigue and burnout. So how do I leverage technology, AI, to complement and work with centricness, really?
mm,
So
mm.
I'm constantly looking at that right now, because it's
Anything
coming.
any particular solution that you've come across or it's on top of your mind right now that you think you're going to be implementing?
So I'd say there's ones that are patient facing and there's ones that are not patient facing. So, and the ones that are not patient facing we're using first,
Mm,
because we can put those into a workflow and make sure that it's optimizing the clinician or the team member's
mm,
time, which then
mm,
then allows them to spend more time with patients. So, things like AI algorithms that are looking at radiology scans, right? And so
mm,
right now
mm,
we've been
mm,
doing that. So all of our images a radiologist looks at, as well as an AI algorithms looking at it. And they're looking together to see, what did the radiologist see, what did AI see,
mm,
what do they agree on, what do they not agree on, and it's meant to, one, make sure that the radiologists don't miss anything, give them another perspective. I kind of think of it as a second opinion, right? They're kind of getting this automatic
mm,
second opinion themselves.
mm,
Um, and if it allows the radiologist to get a scan an hour faster, a half hour faster, 10 minutes faster, well, that is 10 precious minutes. And
mm,
so I think it's about take that win, and then they can tell the physician 10 minutes sooner. And then we can get to that patient 10 minutes sooner of what that scan shows or doesn't show. And when you were waiting on an imaging test and that result of what that means for your life and your care pathway, those 10 minutes feel like a lifetime. So we're working on that, and then we're
mm.
working on some very much patient-facing pieces. You know, kind of the chat bots and the AI assistants inside patients' rooms, right? Kind of
Mm.
taking Alexa and if I say it, mine may talk back to us. Taking any of these, any of the names that we know. I won't say the Apple one, but then they'll all listen. But taking
Yeah.
those, and how do we take them and make them patient facing for the generation that needs them, right? So we have to remember,
Mm,
most patients sitting in that bed are not 23,
mm,
right? They're not 33, most of them. So we have, elderly patients in hospitals who, so you've got a 55, 60 plus, sometimes a 70 plus. They didn't grow up with technology. So their ability to want to use it, their connectivity to it is not the same. So you're kind of pushing all this tech on a group that never grew up with tech, that doesn't know tech, like tech, or isn't engaged with it. Now, when the millennials and the Gen Zers start getting older than that, who grew up with technology, that's a different patient, right? That's a completely different patient. So I think it's just kind of navigating that. So that's really what a lot of my time right now is. Um, that, along with just continuing, how do we continue to help the global community?
Sure. I
In
think what I loved what you said is especially the use of AI. In many of the conversations that I've had, and even in my previous podcast, there was there was always a question around will will healthcare lose its human touch? Will healthcare lose its joy of practice? Because now technology, standardization, AI is coming into play. I love the way you put it, that the time that is actually saved and actually running through the test, you're actually getting closer to the patient and spending time with the patient to understand the pain, the impact, the emotion a lot better, and hence you have the administrative and the rigorous background work being done by technology, and of course you're validating it in parallel. I love the way you put that, because now the time saved is actually used to improve your patient experience and probably give him a better outcome. And I love that. I love it. What a lovely way to end this this conversation. We're coming to the last little segment that we have. Um, Joe, patient centricity is being spoken about everywhere, right? Um, and like you said, you don't want it to be lip service. You
Right.
want this to be actually felt. Patient coming out should say, I will send my family here if something happens, and I know I'm in good hands and of the physician and the entire institution. What is that one role that you think is important for institutions, hospital institutions, and healthcare institutions that are trying to become more patient centric? What is that one organization role that you believe will be important to put in, right? A decade and a half back, right? Your CEO of that hospital said, I think I need this guy.
Yep.
He's going to change the face of patient centricity. What do you think hospitals around the world who are starting off with this journey or midway in this journey lost, and some
Yep.
hospitals are great? What's
Yeah.
that role?
I think it's a very simple role that most of us sometimes don't do, and we don't realize the impact and the role and the person you need when you want to start this work, when you want to talk about this work, when you want to make decisions on this
Mm,
work. There should be a seat at every table for a patient sitting there. So when you want to talk, when and every almost every room you think you couldn't have a patient in, those are the rooms you're supposed to have a patient in. Your executive meetings, your leadership meetings, your staff member meetings, your departmental meetings, your union meetings, your fill in the blank.
mm,
Always leave a seat open for a patient to sit there. Ask them what they think in real time in that moment. Ask them what they think. Ask them what they feel. Ask them how much of a priority this is for them. Ask them anything. Never assume that we know the answers of what's going to be best for them. Let's ask them. And there's going to be variability, right? Not if
mm.
not, a handful of patients will know everything for every patient, but you have to start somewhere. And we have to be asking our customer what's most meaningful to them.
Joe, I love it. What a lovely response. Um, and I love the 1 hour plus long conversation that we've had. Um, it's probably one of the best conversations that I've had in my series as well. It
Thank
was
you.
uh, it was it was superb, and I really hope we get to meet again in person, either when you're in this part of the world or when I'm down in New York City. And this time
Perfect.
when you can take me back to your passion journey as well, so I can see which windows, what happened to them, and
Yep.
what do they look like when Joe's not there.
Exactly. No, they look good. They look good, but they're still there, which is fun. It's always fun to walk by. It's always fun to walk by.
Superb, Joe. Any last thoughts? Any last messages from you?
No, I think this has been fantastic. So thank you for speaking with me. Thank you for giving me the opportunity to talk. For everyone who's listening, thank you for listening. I always say that, my story is a nonlinear one. Some people have very linear journeys, and that's great too. But it's to me, every person you meet, every podcast you listen to, or thing you watch, if you can take just one page from it
Mm,
and
mm,
incorporate it into your book, then that is time and energy well spent. It's never going to be a copy paste, right? Our worlds are different. There's so many differences. Sure, there's a lot of similarities, and if you can take a page out of my book and put it into yours, then I think that's pretty incredible. So hopefully there was a nugget of information, a piece of something that someone could take and incorporate into theirs. So I think it's just about sharing and staying connected.
there's more than just one page, Joe, on this power podcast that they can incorporate into their lives and into their journey. Thank you again for being here, and look forward to continuing our dialogue and having you back on the show soon.
Absolutely. Have a good one.
Take care,
Thank you.
Joe.
All right.